The question during training is always, where do we put the filler? How much should we put the filler? And how deep do we go? So these are three essential questions. So let's address the first question. Where should we put the filler? When we have a look at the lips, in general, in most cases, the filler should be within the middle two-thirds of the lips. If we inject it out on the outer 1/6, then the patient will look like a duck. It's okay if that's what they want. Otherwise, we stick to the standard volumizing technique. So stick to within the two-thirds, and it is also the same true for the vermilion border and also the philtrum. So we stick to the lower two-thirds and not go higher than that. When we look at the side view, this is very important. As to where do we put the filler? Because we are volumizing, we need to put the filler at the most convex point, which is for the upper lip, which is the lowermost and outermost, and for the lower lip, we want the uppermost and the most forward point. So then we have a guide as to where we're going to inject the filler. So if we look at the front angle again, we can easily know on the mannequin I'll show later that it is approximately in that point. So this is a guide, and if one can mark the guide, the line, and to practice on it, and later on when you become an expert, then you can almost visualize the points. When we have a look at the lips, this line represents the outermost and lowermost. This line represents the outermost and uppermost. So you do the same thing on the other side. So this is where you inject the filler underneath those lines. The next question is how much should we place into the lips, and this is again by design. One should anticipate we have total of 1 mil. So for that, as we mentioned, we already got the imaginary line done. As a beginner, you should anticipate that we're going to put 0.2 here, 0.2 here, 0.2 here, and 0.2 here. That makes a total of 0.8 mils. So we have 0.2 mils left. Now, what is that for? The 0.2 mil can be for the vermilion border, or the cupid's bow, and also the philtrum. Or we can use it to correct some mistakes. If the patient says, I want a little bit more here and a little bit more here, so you leave the 0.2 for that correction. Let's assume that this is a line that we're injecting. So here, we assume there's an imaginary line here. And the question is, how deep do we go? If you see the silver of the needle, then you're intradermal and you're way too superficial. And when we go a bit deeper, this is subdermal, you should see the entire length of the needle, the shape of the needle. Then we know we're in the right plane, and this is subdermal. And if we go a lot deeper, you won't see the shape of the needle, and this is way too deep. So the ideal plane is for one to inject into the subdermal plane where you see the shape of the needle, but not the silver of the needle. For the vermilion border, we do exactly the same thing. We put it in and we want to see the shape of the needle. Then you are in the right plane. And for the philtrum, we do exactly the same. You enter and you want to see the shape of the needle. One should practice using the mannequin, injecting in, and then injecting the right amount, which is 0.2 mil, until one is comfortable with injections and comfortable with entry point every single time. So before you practice on live patients, you should keep practicing this and injecting a gel that you can use, fill it with KY jelly or similar, so that you can feel the consistency and you know exactly what to do. Please like, subscribe, and comment.